Welcome back to another episode of I Didn't Know Postpartum Edition. If you don't know, I'm Jeray. I'm a wellness postpartum coach. I help moms prioritize their wellness and re-identify themselves after motherhood. So today we have a guest with us, Tyleshia. Introduce yourself.
Right. Hi, I am Tyleshia Jennings. I am a licensed clinical social worker in the states of North and South Carolina and the owner of Trending Joy Counseling and Therapy PLLC.
Yes. Ooh, that's a good introduction. And can you tell us what is a licensed clinical social worker?
So, a licensed clinical social worker is a person who has gotten the social work degree, gone through the clinical hours of study to be able to provide individual counseling and therapy to clients who are in need. As well, with our clinical license, we're able to diagnose as well.
Ooh, that's interesting. That's good. Okay. So what inspired you to do this work?
To be honest, I had my own social worker when I was growing up. There was a lady in my hometown who helped me with a lot of the things I was going through when I was growing up, and it just so happened that she was a social worker. I actually started off as a music education major and then got back in contact with her randomly. And after music education did not work out because them kids was bigger than me, decided to take the route of going into social work.
Oh, that's so amazing. Especially you never know where life is going to take you and your interactions. So it's pretty cool like that. Then I have to ask, can you tell us about, are you a mom?
I am. I have two littles. My oldest is 7, and my youngest will be 5 on Sunday. So
Oh,
exciting
happy early
times.
birthday.
Hey, girl. Yeah. So I am a mom. It's been an experience. Some days I wake up and be like, "Dang, I really am somebody's mama." But it's fun. I enjoy it.
Yay. I just wanted to let the people know that you are a mom as well as a licensed social worker. So
Yeah.
then let's get into it now. So what issues do you see going on with perinatal mental health?
Honestly, the biggest one is accessibility. So what I am finding in my own practice, so we already know like the statistics around birth trauma and stuff for women in color, women of color, but the other thing is accessibility to treatment. There are a lot of places where programs just not are not readily available to clients who need them. And then also to the process of assessing and diagnosing and treating and stuff like that. If it's not available and people aren't knowledgeable about it, then you get things like, oh, you'll be fine,
Mhm.
or it's just baby blues, or something along those lines, where in reality, a mom or a parent in general could just really be going through it and not knowing where to start.
Yes. So my question will be for you, if there is someone watching, they're like, I don't know how to access these resources to get help, what would you recommend to them?
Mhm. Well, the first line of defense would be to talk to your OB/GYN or the pediatrician if you already have children. Um, I know that in some states it is a requirement for parents to be assessed for things like postpartum depression or anxiety. Or if just trust your gut. If you recognize that something doesn't feel right, find a professional to speak to. We have certain assessments that we use to determine whether or not a person is experiencing the different perinatal mental health disorders. But we don't know to assess if you don't tell us what your reality is.
And that's the importance of being honest. Because I know even with my second son, every time I take him to the doctor, they give me a form to fill out about how I'm
Yeah.
feeling. So it's so important to make sure that you're being honest on those forms so that you can get
Hmm.
help. Like for me, when I used to see the forms, I'm like, are y'all gonna even look at them?
Right.
So
Right.
now I know with my first son, they didn't give me those forms, but with my second son, every time I
Mm.
go, it's like, oh, okay. They're like, yeah, mom, you gotta fill this out. I'm like, okay. So
Yeah.
I want to just mention that. Make sure you guys are honest when you're filling those forms out so that you can get the support. What do you
Mhm.
think? Do you think, for me personally, just thinking about even with my first son, they didn't even do the forms. What should someone do if they are getting the forms, but they're not getting the support they need once they fill it out?
I mean, so there are a lot of places where you can go out and find the resources for yourself. I'm I'm really big on self advocacy because nobody knows you better than you know yourself. You are the person who recognizes when something don't feel right in your body. You're the person who can communicate how you feel, even if you don't necessarily know how you feel. Just if you feel a way, but you know it's not a way that you normally feel, then that's more of a reason for you to reach out. But you have directories. If you have any type of insurance, insurance cards usually have a number that you can call to find out what resources you can access, whether it's mental health therapy, physical therapy, medical care, all of those things. You could use those resources to find different providers in your area. Then there's also the organization PSI, Postpartum Support International, and they have an entire call line where you can get access to resources. They have a directory that lets you know specifically what's available in your area, and you can cater your search to whatever it is that you prefer in a provider.
Ooh, that's really good. Y'all make sure y'all check out PSIpostpartum.net. And then, like, what are the treatment options for perinatal mental health? Like, I hear so many times, people are like they don't want to do medicine, but like, are there other options? Tell us about
Oh,
it.
absolutely. Absolutely. So I like to consider myself an experiential therapist. That means that we work from the inside out. You're telling me or expressing to me how you feel. You're recognizing the parts of your body that are impacted by the emotions that you feel. And then we find a way to work around it. So self care is the big trending topic now, but I think being mindful of how self care is defined it is really important. Like you're not just going out and getting your nails done, hair done, going shopping. No, you're giving yourself an opportunity to really sit down with the emotions, recognize how it's feeling in your body, where you're feeling it, what type of sensations are coming along with it, whether it's pain, tension, pressure, and you're giving yourself space to reconnect with you so that you have a way to determine a next step in the situations that are causing you these different emotions. So self-care is good, therapy is good. Trauma therapy is a big one when you're associating with perinatal mental health care, because a lot of us have these experiences based off of traumatic experiences, whether it may be the birth experience or the loss of the pregnancy experience that you may have wanted. Um, Everybody identifies trauma as something different. But the root of trauma, or at the root of trauma, it causes you to change how you operate and change how you go through situations. It causes you to operate in your fight, flight, or freeze. So we want to help you get to a point where you're no longer having to survive your experience. You're learning how to thrive in your experience. So that means allowing yourself to recognize and do something about the emotions that you feel, allowing yourself to recognize and do something when your mind is telling you one thing, but you know that that's not your reality. And really saying, I need help. The saying out there is it takes a village, and does, because it absolutely
Yeah.
does take a village. And if you're recognizing that you don't have the personal support system that you desire in your postpartum experience or in your pregnancy experience, that's more of a reason to seek out the professional one. So, you don't necessarily have to go the route of medication. And I am not saying that I am anti medication, because I am all for it. Because the reality is that perinatal mental health disorders are just like other mental health disorders, and they're caused by chemical imbalances. And sometimes we will need medication to balance the stuff out. Doesn't mean that you'll have to be on it forever. It could be something short term. It could be low dosage. But giving yourself, or being open to giving yourself the opportunity to heal the way that you need to heal, and recognizing that there's more than one way to do so.
Ooh, yeah, that is so good, especially just saying it takes a village and being open to the different treatment options are important instead of just saying, oh, I don't want to take medicine. Like, if it's needed, be open
Hmm.
to taking it because you want to get better. You want to be able to show up for yourself again and just be a better for your home and the others around you because it's like a domino effect. So
Right.
you want to make sure that you are taking care of yourself, and then it's like it's a lot of stigmas around perinatal mental health. I know a lot of people talk about are more aware of just about depression, but what are some stigmas that you see and hear as a
Yeah. I mean, I think the biggest stigma is that people of color experience these things differently than everybody else. I think the stigma overall is just related to mental health care in general, because you'll hear, or maybe speak for self, I'll hear people in our community say, "Oh, it's just a little bit of sadness. Oh, it's just the baby blues." Oh, so y'all know that something changes, right? Like you get it, you understand it, and everybody's experience is different. It's some people have a more extreme experience with the mental health needs. So, I mean, when it comes down to stigma, is one, the belief that mental health care doesn't work. I totally disagree with that. I think that you have to find somebody who meets your needs. I don't believe that every therapist is for every potential client, but I think that there is a therapist out there for everybody. I also believe that we have to get past the point of thinking that perinatal mental health care is only for birthing parents,
Mhm.
right? Because, like you said, everybody is impacted by it.
Yeah.
Majority of the clients in my own practice are new dads. So it's not just mom that's experiencing this, dad is going through it too.
Mhm.
And recognizing that it is, again, okay to need help. um Gosh, there's so many things I could think about, like like
Yeah.
I could literally just go down the list, and I'm trying to, like, not get too deep into it, but I think we in general have to get past our own fear, and in some cases our own pride. I think pride is one of those things where we find ourselves, I'm strong. I'm supposed to be able to
Mhm.
handle this. I can take care of myself. I've been doing it this long. And all of those thoughts, in my opinion, are based in survival,
Yeah.
because that's all that people know in some cases. But just because it's all that they may have known for the first part of their life prior to pregnancy, prior to becoming a parent, doesn't mean that it's the only option. And so bypassing the pride, acknowledging the fear of what comes with like needing help, but then also too recognizing that needing help doesn't automatically mean that you're going to lose your kids. Needing help doesn't automatically mean that you are weak. Needing help doesn't automatically mean that you're going to be judged. It just means that you're human. And if we can learn to accept our humanity, then in some cases it might make it a little bit easier for us to accept the help that we need when we need it.
I love that you said that as well because it made me think as you were talking about like even comparison, like comparing yourself against like whether your mom or your grandmother or other moms around you, like you think they handle it so well, like they didn't need
Yep.
anything, they don't talk about it. But in the sense of you don't really know what was going on in their mind. And
Right.
oftentimes sometimes people snap like they because they didn't get the help they needed and they just let it build on. Especially, I'm gonna speak for myself too. I just know for times like when I try to carry everything, it's just like at one point you're just like, I can't do it anymore. Versus like, hey, if I would have asked for help, this could have been minimized.
Right.
I also think too is like don't compare your journey or your motherhood experience to other moms because at the end of the day, everyone is fighting their own battles and everybody handles stress experiences all differently. So I think that's also something people should be cognizant about.
Yeah, absolutely. Absolutely. It's and I am a firm believer in that. Like my thing is when I'm talking to my clients, I'm gonna meet you where you are. You tell me where you want to start,
Mhm.
because my experience is mine. And I don't know what you went through unless you tell me about it. So if I know where you want to start, then that's where we'll begin. It's not to say that we won't make the connection to the other things later, because we will.
Mhm.
But this is your journey, this is your experience, and you know where you feel like you need the most help.
Yeah.
It comes out naturally, even if we don't necessarily expect it. Once we give ourselves the opportunity to really think about what it is that we're going through, it'll come out. Like it'll just word vomit. Like
It's the
there it is. This
vulnerability aspect
right.
of
This
it.
exactly. This is I'm given the chance to be vulnerable, and therefore I feel heard. And when you feel heard, you're more likely to be honest about your situation and operate in your authenticity. And I think that a lot of times, especially since there are, well, now there are more, but the limited number of people of color who are therapists and
Mhm.
providing these services. And then also too, the newness of perinatal mental health diagnoses. Our parents and grandparents very likely had these same experiences, but
They
maybe
couldn't
they
put a
didn't
name
have a
to
name to put to it, right?
it.
So, I believe that when you have the ability to name things, it gives you more power over it, right? Like I can name what my anxiety looks like. I can tell you exactly what depression looks like in my life. And because I can recognize it, I also have the ability to do something about it when it comes up, or potentially prevent it from happening because I know the trends and the things that come along that cause me to feel this way about the situations that I'm going through.
It's that self-awareness that you have to
Yes.
yes, you have to tap into, like, your inner self. Like, I love how you even talked about in the beginning, talking about the importance of self-care. It's not even just
Mhm.
external, it's internal, and the more time you spend with yourself and sit in your feelings, you're gonna have that self-awareness to figure out what you need, and you can
Right.
voice that to others. So, because ooh, look at us get ooh, you already answered my next question because I was gonna ask you, like, what's the best way to support new parents, but just even talking to you is just like thinking about creating that safe space for them and giving
Right.
them those resources. But do you want to add on to that? Because that's what I got from just hearing you already. So what
Yeah.
else would you add?
No, I think that's really it. I think that giving space, like allowing for space, allowing for non-judgmental space. One thing that I have learned to put into practice, both professionally and personally, is to ask what they need. Do you need an ear? Do you need advice? Do you need resources? Like, you tell me
Mm,
what it is that you desire out of this interaction. If you need an ear, I'm going to shut up and listen. I ain't got nothing to say. If you need advice, I'm going to wait till you done and then give you my point of view. If you need resources, I'm going to come up with a list. You might have to give me a couple days to get back to you, but I'm going to come up with a list of things that may benefit you if I can't spout it off right out there off of the bat. Like, so it just offering the safe space, um, creating a way to help them prioritize what is important to them as
yes.
well. Um, a lot of times, what I find with my parents is that it's parenting over everything. I've heard, and I'm guilty of this too because I am human. One of the things I have to remind myself to do every day is to eat. I
Mm.
got to make sure that I eat something. And I'm not talking about like just snacking and nibbling and getting on junk
Any
food. No, I need to
nutrition.
eat. I
Mm,
need something nutritional. I need to hydrate because I'm not taking care of my kids the best way that I can if I'm not taking care of myself and showing them how to take care of themselves. So, teaching priorities, creating the safe space, recognizing and placing value on self-care, and then also, like I said too, recognizing that self-care isn't always going to be the topical stuff or the superficial stuff. Like,
mhm.
doing the work internally to make sure that you are the best version, or the version of you that you want to be most.
Yes, because now you make me want to switch it up too. Because like usually I ask people, how can I support you versus using those 3 things, like, do you need an ear? Do you need advice? Or do you need
Hmm.
resources? And I think
Yeah.
that's gonna give them more of an idea of what they're gonna need because oftentimes people don't know what they need until they're in it.
Right.
And I'm gonna even apply that to my own life, just asking,
Mhm.
like, do you need those things versus just saying, how can I support you? Because that's more specific.
Yeah.
And it can allow them to have a response of what they need. And I really think that's super powerful. That even just, ooh, that just changed my perspective as well. Cause like, wow, I should start asking people those 3 things versus like me
Yeah.
trying to like figure out what it is that they need.
Hmm.
So
Yep.
yeah.
And I want to go back to that too because I had learned the value of that because when I was going through my own experience, it was, I'm here if you need me.
Mhm.
Reach out if there's something I can do for you. But that puts the responsibility back
Oh,
on me, and I'm already in a place where I can't even tell you what day it is.
mhm.
I'm home on maternity leave. What do I need? I don't know until I'm actively in it, right?
Yeah.
But at least if I'm offering options of what I can do, what I'm capable of, and all you have to do is make a decision, right? Even if you can't make a decision in that moment, you know that this is what I am offering you as your support system, because this is what I am fully capable of in this time in my life. And it's putting less responsibility on you to decide to ask me for something that I might not even be able to offer you.
Mhm.
You know, if you ask me to make you a week's worth of meals, ooh, beloved, I ain't got that type of time or energy.
If I can find you
But
some resources.
right, I can find you. Look, you want some DoorDash? Like, so it's being mindful of, if you're going to be a support, be mindful of what it is that you really can offer, and then present it in a way where you're taking responsibility for what you're offering versus placing responsibility for what you're offering on the person who's asking you for help.
Yes, because I also thought too, but back to your point, that's why I do postpartum planning, because it's just like you can plan for those things and have it all listed out. Because when you come home, you're not going to have that thinking space of like, okay, what do I need? How can I be supported? Versus giving that, having that clear space prior to it. So just
Right.
even thinking about that, like, even if you're in a space of like, oh, well, I'm preparing for baby, please plan. Please be
Yes.
specific as possible from how you mentioned. What does meal prep look like for you? What kind of food are you going to eat? Because even
Hmm.
though people want to do meals, but if they don't know what you like to eat, then it's just like, okay, I can't help you
Right.
out. So it's
Yeah.
just so many factors that come into it. And as we wrap up, I want to first say thank you for your time, because I feel like you poured into me. Like I was just sitting there talking to you on the porch.
Oh, yay. Good.
So yes, what before we wrap up, what advice would you give a new parent who's feeling overwhelmed from this transition right now?
Hmm. Um, just because you're overwhelmed, it doesn't mean that you're incapable of pushing for it. And I don't often like really preach on resilience. And I also recognize that resilience is human nature.
Mhm.
So give yourself grace in your process, because you don't know everything. You won't know everything. And if you're unsure about the best way to go about something, the best method or the best way to go about it is just to ask. Um, I I like in practice, what I tell my clients, we gonna throw out some ideas. You know your life, you know your experiences, you know how you want things to go. Pick and choose from those ideas. If it works, great, keep it up. If it doesn't work, be willing and open to coming back to the drawing board,
Mm,
because everything isn't going to work for everybody all the time.
yeah.
And just give yourself grace to go through the process, because that's what you need. You're still learning. It's okay. If you operate as if you're learning and not as if you already know, then you'll be more willing to make the changes that you need to make.
Yes, that's really good. It's also being you gotta know what season you're in too, because sometimes some
Right.
seasons are slower than others. Because I even know something that I had to learn with my first son is like it's okay to have a slow season. It's okay to be at home more versus trying
Mhm.
to still go out and hit the streets. Yeah. And
Right.
it's gonna be overwhelming for you. So you have to be also, like how we said, have that self-awareness of where you are.
Mhm.
And just know each season is gonna change. Like before you know it, you're gonna be in a different stage. Like I just told my husband this morning, we're going into a new parenting stage. So now
Yeah.
my 8-month-old is crawling and
Mm.
he's like, I'm not sitting in the rocker anymore. I'm not like I'm trying to follow my big brother. So it's just
Yeah.
like we had to understand like we're going into a new season. Now it's time to transition his toys and
Mhm.
it's tough sometimes, like wow, like I it went by so fast. But
Yeah.
as you're in it and it's tough, just know that it's gonna pass. You have to just give yourself grace with it.
Yep. Absolutely. Absolutely.
And so how can the people find you?
Ooh. So I have Instagram, I have a website, and I have Facebook. Instagram is at trendingjoy_PLLC.
Mm.
Facebook is the same thing. Just search Trending Joy Counseling and Therapy PLLC. And my website is trendingjoypllc.com.
Yay. Well, thank you so much for joining. I'm definitely gonna put it down in the description below. So if you guys are like, oh, I just want to click the link, I'm gonna put all of those down below. And I really appreciate you taking the time out to come pour into some mamas, some parents, some everybody, some of the community, okay?
Yes,
And you
absolutely.
guys let us know what your thoughts below and subscribe. And thank you so much. And until next episode, I'll see you guys later.